Innovations are changing the healthcare systems. The experts say that we're gonna live longer, but we're gonna live longer in health. The question is how to answer the demands of the patients and of the doctors, how to transform the healthcare system so they are better adjusted to the needs and the future forecasts of the healthcare markets. Today, my guest is Tomasz Rudolf, co-founder and CEO of Doctor.One. We will talk about innovations that are shaping the healthcare markets.
Thanks for inviting me.
Great. So maybe before we start talking about Doctor.One, tell us more about you, about your background and why healthcare.
Well, that's a good question. I've spent more than 25 years now building companies and working on innovations, initially with big corporations, then more with startups. And I set up a startup studio, The Heart, together with MasterCard and run it for a couple of years. And healthcare wasn't something that was really focused. We worked more in retail and fintech and other industries that were really digitizing very quickly, helping them design their future business models. And healthcare was actually a coincidence. I went with my son back to one of the children's hospitals where I was a patient 35 years earlier. And I saw the big need for transforming processes to be more customer friendly and so on. And I set up a foundation called Kids Foundation that helps transform children's hospitals, and that's how I got really deep into the future of medicine, the future of healthcare and digital health. I met my co-founder Maciek Malenda, who's then leading innovation in Medicover, and together we joined forces in a joint vision that this could actually be done way better for doctors and way better for patients.
Still, before going straight to Doctor.One, I would like to ask you about some trends and some observations you had about the healthcare market in Poland or in general in European countries that actually made you come up with the concept we'll talk about in a moment.
Well, I think it's a fascinating space because on one hand, it's a very conservative group. Doctors are trained for years. And if you look back at the beginning of modern healthcare, it took us around 40 years from the invention of antiseptics to get doctors to start washing hands, even though it seems not really high tech. But those changes take time. It's a very evidence-based area. You need to prove that something works. So this space is, on one hand, conservative. On the other hand, so much is happening with AI, with new technologies, with access to data, and something that was a very analog process based on the relationship between the doctor and the patient is now radically transformed, and obviously COVID was a great trigger for proving that not all interactions between the doctor and the patient need to be done in the doctor's office, and we will be seeing, I think, a radical transformation of the whole patient experience in the future, and in how doctors and their care teams work.
And that's how we come to Doctor.One. So tell us more about your innovation.
What we saw is that everybody in this space, especially investors, are betting on AI, and that the solution to the problem of shortage of doctors, I think WHO estimates that we'll be missing 4 million doctors in the system worldwide by 2030, which means that we should have 30% more doctors. And everybody's betting, okay, so let's automate stuff so that doctors don't have to do it, or let's move everything to self-service so that patients can help themselves, like they do right now with Dr. Google. I think 89% of Americans check symptoms online before they go to any doctor.
Which is not the best option.
Which is not the best. So everybody's betting that AI will cure us. And we are seeing that actually automating and industrializing everything is not a solution to all problems. There will be obviously things we can automate, but the pressure for doctors to do stuff way quicker is limiting. Doctors are burning out with shorter and shorter visits, and what they really need to work and to provide great healthcare, not just sick care, solving problems, but really caring for long-term health of the patients, is their old traditional relationship with the doctor, between the doctor and the patient. And what Doctor.One is really the doctor doctor that knows you, available directly in your phone. We've built a platform that helps doctors build a private practice in a new model, rather than selling transactional visits to sometimes anonymous patients that they will never see again. They can invite their long-term patients to a direct relationship through the app, stay in touch. Whenever the patient has a problem, they can write, and they know when the doctor has their daily round, they respond to all those messages, they can issue prescriptions, they can guide the patient what to do next and when a physical visit is necessary. And through this, we are really bringing back this relationship to healthcare so that care can be really care again for patients you know and you care about.
But you started to think about the concept when COVID started, or actually it was before?
Well, Maciek, who was initially, his wife is a doctor. He's been exposed to all of this for over a decade now. He was thinking of something similar in that direction of connecting, building a trusted communicator between the doctors and the patients, if you will, a medical WhatsApp. What we were looking together and what brought us together was really connecting this with the subscription-based business model. I've been a fan of subscription-based business model and how they transform the relationship between providers and customers. And obviously, doctors benefit from that subscription. They can move away from just selling more visits. They're anyway working really, really hard. Many of them over 60 hours a week or more. Some of them even over 80. And it's amazingly it's amazing to see how that long-term subscription and that relationship changes the healthcare experience for the patient and for the doctor.
Mm-hmm. So on what level of the development are you now with DoctorOne?
Well, it's all been very quick. We started in 2021 in May. We closed our first round a month later, and we launched this last December.
Investment round.
Yes.
Mm-hmm.
And we launched last December, so we've been now over a year in the market with over 100 doctors that joined us in helping us shape this model, design the new care paths for pediatricians, for GPs, for family medicine, and we have, I think, over 30 other specialists now that are trying to redesign how they care for patients for this hybrid relationship, where obviously there are still visits, but between the visits, and sometimes the visits aren't necessary always, the doctor can just communicate with the patient for a minute or for 2 minutes or for 3 minutes over the year, and that changes the dynamics of the treatment.
And probably what is important is that you have it registered, yes? So even if it's some message or some call,
all in the mobile app. It's secure. We are formally a medical service provider, so we're not just a technology company. We are actually a healthcare service provider, helping build this network-based company based on a group of doctors that are really building their independent private practices, but joining forces with other doctors that think the same, that healthcare could be better and should be better.
And I think that also leads us and the doctors to the better responsibility, yes, because I think that the problem of current healthcare system, the traditional one, is that sometimes even if you have an access to the doctor, it's not necessarily the same doctor that knows you. So if each time as a patient you meet other doctor, it's really a question mark who is taking responsibility for your health.
We definitely need to be responsible as patients, but it's nice because we are not experts if we can have this trusted person that knows us, that guides us throughout this process. And even our majority of our patients right now are pediatric patients, so young parents that have hundreds of questions sometimes. And for them to go at night or evenings always to the hospital, it's inefficient for the system, it's bad and stressful for the kid and the parent. So we know that if the doctor knows the parents and if they can be in constant quick contact, like on a WhatsApp, on a medical in a medical secure space, that actually is way better for everyone. And the doctors that know their patients can manage it in a way that protects their work-life balance.
Well, it seems like a very good solution for our times, but what are the hurdles and what are the drivers from your perspective? What's the biggest challenges to develop the model, whether the trust of the doctors or whether the trust of the patients?
Obviously, COVID has been a huge driver of adoption of telemedicine. I would add here that a new generation of digital savvy doctors, digital native doctors, is coming, and they want to work in a different way than maybe their parents or friends that came before them. And obviously, patients expect a chat-based or a mobile contact with their doctor. They don't think it's actually efficient to come with every question, book a 20-minute visit to just ask a question, what kind of checkup should I do or whatever. So we think the shortage of doctors that will be growing, and even just now, 5 minutes ago, I was checking to see a dermatologist. I see 0 visits in the coming weeks in my system, in my private healthcare. So the access problem will be increasing, and we know that we need to protect the time of doctors. So that is a great enabler. Doctors want to work in a smarter way, not harder, because they're already overworked. Patients want a better experience, and that is helping us a lot. What is a hurdle, and I think it's a hurdle with any innovation that's not copying 100 other models, but designing a new path, is that we are a new model that's not clear for the patient initially, not clear for the doctor. Okay, so how am I selling an unlimited access that might be multiple questions that patients might have? How shall I price it? Will the patients not overuse it? Which we have now data after a year to see that they don't. And it's actually in 10 minutes a day, you might have 50 patients that you support, earn additional salary from supporting them. And it's not a lot of work. Patients that's not their hobby to write to their doctors. But obviously, there are those questions, and until you find a group of early adopters that we were lucky to find, that say, yeah, it sounds great to me, let's try it. So getting them was really a struggle initially. We onboarded, or we talked to hundreds of doctors, and we had to find those pioneers with an innovator at heart, in their heart, but also with a big frustration with the current system. And now we are seeing that those first contacts of those that were skeptical, they were waiting for others to see how it's working. And now they're joining again. So that was our challenge, which I think is common with any healthcare innovation specifically.
Okay, so let's talk now on the investment side, yes, because obviously, I mean, COVID also made it that healthcare became very much on the agenda of the international investors. So I'm wondering whether you feel the same from your perspective.
Well, we were lucky that obviously we were fundraising both our runs during COVID, and healthcare was a priority. Healthcare is a strong sector in Poland anyway. If you look at PFR statistics of venture capital investment, healthcare is by far the biggest, thanks to DocPlanner, Informatica, and other great companies that have been paving the way of international growth and buying German competitors and expanding worldwide. So healthcare in Poland is, I think, a very strong sector. We have a super strong IT sector. What was maybe missing sometimes was the connection between the medical community and the IT community. So I'm really super happy with what's happening right now with the current Chamber of Doctors. I was personally involved in starting an innovation network of doctors that are really getting active, building their startups, adopting those digital solutions in their practice. So this is really a good moment for healthcare companies to be built. Doctors are ready, patients are looking for solutions, and the societies need a better way to be ready for the aging society, for the chronic diseases which we all have, and for solving the problem with prevention, which is something we still don't do much enough of. And I think Charlie Munger said that if you don't know what's really the reason, look at the incentives. And if we look at how we're paying doctors, if we pay for a visit, we get a visit. And we don't get additional support or reminders about checkups. We don't have a relationship with a trusted doctor that challenges us to lose weight or live healthier. And they don't think it's part of their job. So the current system is really a sick care system. If I have a problem, if I need a firefighter, firefighter, I go to the doctor and they fight the fire. But it's not really a fire prevention problem. And I think we need to redesign the whole system to be more friendly for prevention and more supportive of that. I think we are in a great direction, both in the public system with care coordination reform, where patients, especially those with chronic diseases, will get better coordination of care in the system. But we believe it's not just a challenge for the bureaucracies, it's also a challenge for how doctors work. And they changing their habits is not easy, but we believe it's the way to go. And the future of healthcare definitely will need to be more continuous, not just one-off consultations, especially with remote patient monitoring, with the devices we can have in our home. We don't need to go and have a checkup once a year. It will be a continuous checkup with devices or that we might have at home, or monitoring devices, reporting some irregularities to our doctor that knows us, and that doctor will tell us what to do with that.
Exactly. So it's about embracing technologies in a smart way, then definitely. You mentioned Dr. Planner, so I would like to also ask about your plans of expansions as Doctor.One, because the concept seems to be well suited for not only Poland but also other markets.
Yeah, and our ambitions are global, definitely. We see that especially the out-of-pocket countries, so countries where patients have been unsatisfied with what the public sectors have been delivering, and filling the gaps in the system out of pocket are our natural way to grow. We've started with Poland. We're now preparing rollouts in other European countries. Still, maybe this quarter we'll be rolling out our first countries in Western Europe. But I believe, frankly, having worked in both US and India and other countries, that in many ways, healthcare access to great healthcare is a problem. I think from the 8 billion people worldwide, around 2 have access to really modern, good healthcare. For others, it's still a challenge. So I think we'll not build super hospitals or modern clinics next to every village in Africa or India, but we can connect the doctors and their patients in new ways, just like Airbnb is leveraging the existing communities and existing resources, and we can help them work in new ways. And that's what we're trying to do.
And I think I would add on top a transparency, which is very much needed.
Exactly, yeah. And a supportive care path and a supportive business model that helps the local doctors just love their job again.
Mm-hmm. Okay, so now looking into the future, you already mentioned that you found your early adopters, so you're on a good way of development. So where would you like to be in 5 years? What is your business plan?
I think what we definitely would love to do is scale this to thousands of doctors and scale this across Europe. Hopefully, enter also some other continents in the coming years. And what we would love to become is a new standard of care, that everybody has their private doctor and they're in constant contact with them in the secure app. And that's how healthcare, we believe, should be done. It shouldn't be a call center of anonymous people meeting each other for just a transactional one of interaction. Even if data supports my background in the database, it takes the doctor a lot of time to digest it all and to know it all, and definitely a lot of time to build trust that is necessary to be an effective doctor and impact the behavior of patients, which I think in the case of modern medicine, it's definitely a lot about the doctor-patient relationship and influencing behaviors that help patients live a healthier life.
That means that actually your ambitions go much more beyond the business models and business itself.
Definitely. I think you might say we're idealists. Obviously, we want to build a very strong business, but we believe our bottom line and our end goal is way bigger than that. We would really love to make a mark and help doctors work as they would love to work. And many of them chose this job because they wanted to help people, and many of them feel burned out by this industrial system with conveyor belt moving their patients. And I think we can do it smarter and more human. So at the end of the day, our goal is to humanize healthcare again and bring bring back to its roots. And I think it will be great for doctors, and it's something that we all can enjoy. And just giving you an example of something that really melts our hearts is if the patients tell us the doctor the day after the visit is checking with the patient and asking how is little Basia feeling after the night. And it's so super simple, but doctors in the current system don't have the time for it. They are not remunerated for that properly, and they don't even have the technology channels to do that. And I think we can bring this back.
Well, good luck with your concept. I really love it. And let's take what you've said, that humanizing healthcare, as a one-liner of our discussion. Thank you very much.
Thank you very much.